Hey guys, my name is Alex and welcome to my channel. Have you ever had an HIV positive friend? Have you ever thought about what it would feel like having an HIV positive family member, or finding out that your boyfriend or girlfriend has HIV or AIDS? Or maybe you're watching this video just because you're curious, which I hope is the majority of you. Now obviously there is HIV and there is AIDS. So in this video I'm gonna focus more on HIV, which is a human immunodeficiency virus, and there's a big difference between HIV and AIDS, which is acquired immunodeficiency syndrome. There are three ways of getting infected with HIV. Firstly, as most of you know, through sexual intercourse, which is responsible for more than 60% of all infections around the globe. And in the UK itself, this figure was 95% in 2015. Through injection drug use, so by sharing a syringe with an HIV positive person, and there is this thing called vertical transmission, which is when HIV passed on from mother to a child. Now, if you want to know the risks of getting HIV, these are as follows. 90% when transmitting blood, 30 to 45% when a positive mother gives birth to a child without a special therapy, and we'll talk about it later. 30% from injecting drugs in blood vessels, and somewhere around 0.1 to 1% from a sexual intercourse without a condom, depending on the type of sex you're having, with oral having very little chance of infecting the person, around 0.1%, and anal having the biggest, around 1%. Now looking at the last figure, many people might think that it is incredibly low, and frankly saying it is. However, there are so many variations, and this is just an average of a person getting infected, so the chance might really range anything from 0.1% to as high as 35%, depending on different factors. And that is exactly why governments around the globe encourage people to use condoms while having sex, because many people don't treat this seriously enough. Because people might look just at this one figure of 0.1 to 1% and misinterpret it, and that is why it is widely talked about in schools when teenagers start having their sexual lives. So my personal advice is, if you're not sure of HIV status of the person, better not risk it. As many of you know, HIV is not transmitted through friendly kisses, handshaking, coughing, sneezing, through air, ground, or water, through any kitchen appliances, or really pretty much anything that surrounds you in the house. This is explained by the fact that although saliva, tears, urine, and sweat do contain HIV, its quantity is simply not enough to get another person infected. However, even if the infected person's blood somehow has gotten on the surrounding areas, it can be disinfected with something as simple as peroxide. What about when there is an HIV positive person in the relationship? Can you have a successful relationship with the person who is HIV positive? As a gay person, I question myself on this one quite often, and right now I'm of the opinion that yes, although not without complications, a good relationship with an HIV positive person is more than possible. The biggest issues really that come up in the relationships with different HIV statuses is when one person overcares the HIV positive person, or vice versa, when the HIV positive person worries too much about not infecting their partner, so that would give up their sexual life at all even. My advice is really, in this case, communication is the key, just like in any other relationship. So if there is something that the person is doing and you don't like it, address it, talk about it, and find the solution together. Another big one is the changes to the body that ART, which is a therapy to control HIV infection, can cause. And you can read about it in the article I'll put in the description down below. However, good news are that most of the bad symptoms that appear when the person starts going through ART disappear within the first month. Another good thing about ART is how great it is. Not only does it help an HIV positive person to live a normal life without really seeing much of a difference between HIV positive and HIV negative person, but also it protects their partner, if they have one, from getting infected. Moreover, an HIV negative partner can take special medicine that would prevent them from getting infected. Plus, you can always use condoms as that extra layer of security, just in case. Also, just a quick one, if you are in the situation where you might have been exposed to HIV recently, There is this thing called PEP, or post-exposure prophylaxis. So basically, if you think you might have gotten infected with HIV, you should contact your doctor as soon as possible, because he might give you treatment so that HIV infection doesn't develop within your body and you don't have any problems with it. The other common question that could rise, mostly in the straight relationship but also in the gay relationship: how are we supposed to have kids if one of us is, or both of us are, HIV positive? Now, for men it's a bit more difficult. You can actually wash the sperm, but it's quite costly. It's around $10,000, at least it used to be in 2015 in the US, but it is possible. With the woman it's a bit easier. There is this special treatment that the woman can forego that would decrease the chance of the child being infected from around 40% to as low as 1% in countries like UK and the US, and for example around 4% in less developed countries like Ukraine, which is still a pretty good chance of, you know, a child being healthy. Again, I'll put the link in the description to all the info I've just used, and you can read more about it. So although there might be some social and financial complications to being in the relationship with an HIV positive person, it doesn't differ much from any other relationship, if people don't let that happen, of course. When HIV became well known to public in 80s and 90s, hardly anyone knew anything about it, how it spread, how dangerous it was, and what exact influence it had on other people. This resulted in society treating HIV positive people with prejudice, trying to avoid them. Again, the fear of unknown has become a determining factor in people's hate towards others. So I hope this information will make you question the way this society treats HIV positive people, and maybe even the way you personally think about them. As always, thank you very much for watching. If you have a friend or relative who needs to watch this video, don't hesitate to share a link with them. Be proactive in sending this information, and I will see you in the next video. Bye guys!